Hello, this is Dr. Alan Hatch at Saline Heart Group. We're here today to talk to you about Congestive Heart Failure Clinic and why we are initiating a Congestive Heart Failure Clinic. Today in the United States, over 43% of Medicare dollars are being spent on congestive heart failure alone. This represents over $40 billion. Now, if you look at hospital readmissions, which has been a main driver for congestive heart failure clinics, over 25% of the patients who are admitted to the hospital are actually readmitted within 30 days. This represents a lot of money, and a lot of money for small hospital and medium-sized hospitals. Saline Heart Group is an independent group, and while we are not tethered to any particular hospital and these issues do not directly affect us, it does directly affect our patients. We see a more positive way to go about decreasing these readmissions, and that will include simply coming up with a good congestive heart failure education program. Our goal is to have our patients understand their staging, understand their classification, and begin to learn things that will decrease these episodes of congestive heart failure and increase their longevity and simply make them feel better. Our congestive heart failure program will start with our advanced practice nurse who will begin the classification process at the hospital. She will also help us stage the patients and organize their medications and communicate these issues to another mid-level provider directly in our congestive heart failure clinic. In our clinic, the patient will be reclassified and also will meet our congestive heart failure RN coordinator. Between the mid-level provider and the RN coordinator, we will make a decision on exactly how often we need to have patients come to clinic. That have been shown to decrease mortality among congestive heart failure patients. One is simply seeing a cardiologist at the hospital. That has been shown to decrease mortality and improve outcomes. Another is simply seeing the patient sooner after discharge. Our goal is to begin seeing patients in 48 to 72 hours. This actually will beat the 1 week mark that has been set nationally. Our goal will then be to begin the education process. We believe we have one of the better educational programs in the whole state, if not the whole country. We have cardiac rehabilitation and a robust program known as the Ornish Reversal Program. That program is not only capable of reversing heart disease and diabetes, but will also be utilized to treat patients with congestive heart failure. This has been approved by Medicare in the last few months, and we look forward to having our patients begin this program. For patients who are not capable of this intense program or do not have time or do not qualify, we have traditional cardiac rehab, which itself is a robust program and will again improve patient outcomes. Follow-up with a dietitian, we have also found, is important. Patients learning more about sodium and water intake, proper foods, and timing of this intake, we believe is vital in the care of congestive heart failure patients. In addition to seeing the dietitian, medication reconciliation, that's when we get all the medications together and make sure that they are on the appropriate meds. This will take place within the auspices of the clinic itself as well. Once these steps have been carried out, the patients will undergo monitoring. We have a robust monitoring program as well. This involves laboratories, including proBNP levels, available at a cost much less than hospitals and right here within the auspices of the clinic. Results will often be available same day. Cardiopulmonary exercise testing is another robust monitoring program. Simply stratifying patients or determining if they are mild, medium, or severe will have a great impact on patient care and will help us to determine how aggressive medications need to be and how often we will be seeing patients within the clinic. We also have an excellent echocardiography program that allows us to estimate pressures inside the heart. All of these programs have been aimed at improving patient outcomes and improving patient quality of life. Again, in the end, we hope this has a positive effect on our hospital, decreasing the readmission rate. Interesting fact is that hospital readmissions, which account for a huge amount of dollars in this country, are in fact led by congestive heart failure, schizophrenia, respiratory diseases, severe blood pressure problems, and even alcoholism and drugs, which account for a huge number of readmissions, are all outpaced by congestive heart failure. We believe that we can make a big difference for our patients and for our community and for our hospital. We look forward to your participation in this great program. Thank you.